Hello everyone. I hope you're all having a fantastic day. This friendly worm is here to welcome you to our session. Let's dive into the fascinating world of anti-helminthic agents. Welcome to the Pharmacotherapy of Infectious Diseases, RPB 20903. I'm Dr. Omar, and I'll be guiding you through this important topic. Today, we'll be focusing on anti-helminthic agents. Today's topic is anti-helminthic agents. We'll be covering three key areas: the classifications helminths, especially the parasitic or pathogenic helminths versus free-living helminths, their life cycle and the available pharmacological treatments, including its mechanism of action and contraindications. Let's get started and explore these important medications. Helminths, or parasitic worms, are complex organisms. They range from small microscopic worms to quite large ones. Helminthiasis is the infection they cause. It is a global issue, especially in areas with poor socioeconomic development. Many are intestinal worms that are soil-transmitted and infect the human gastrointestinal tract, such as stomach and small or large intestine. Other parasitic worms, such as schistosums, reside in blood vessels. Let's clarify some terms. Ectoparasites live outside the host, while helminths are endoparasites, living inside the host. Helminths can manipulate the host's immune response to survive. Symbiosis is a mutually beneficial relationship. We see examples like fungus-growing ants, lactobacillus in the human gut, and clownfish living within sea anemones. Here are some examples of ectoparasites. Leeches are hematophagous, meaning they feed on blood, example, human blood. Another example of ectoparasites are the monogenians. They attach to fish and suck their blood. Some classify Israeli occupation as an act of ectoparasitism, such as leeches and monogenians. Aquatic leeches can act as endoparasites, for example, when they attach to the mucous membranes of the human body cavities, such as the throat, nose, and even the eye, if the host has swum in or drunk from unsafe water sources. Parasitic worms have complex life cycles. They can't reproduce entirely within a host. To their advantage, their eggs have strong shells, allowing them to survive in the environment for extended periods. This diagram shows the life cycle of Ascaris lumbricoides, also known as the roundworm. It starts by ingestion of parasite eggs. Those eggs hatches to larvae in the small intestine. The larva then can migrate through the bloodstream to other parts of the body, such as the lungs, trachea, and pharynx, and the larva gets re-swallowed into the stomach and small intestine where it matures, and hatch new eggs ready to infest a new host. Helminthic parasites are classified into various groups. We'll focus on Annelida, known as segmented worms, Plahelminths, known as flatworms, Nematoda, known as roundworms, and they infest the human intestine. And finally, Acanthocephala, known as thorny-headed worms. Note that platyhelminths or flatworms contain 4 subgroups, including Turbellaria. Monogenia, trematodes, also known as flukes. They infest the blood, liver, lung, or brain. And finally, the cestodes, also known as the tapeworms, and they infest the intestine and brains. Remember, ringworm, or dermatophytosis, is caused by fungi, not a parasitic worm. Let's start with the annelids, or segmented worms. They are a diverse group. Examples include ragworms, earthworms, and leeches. There are over 22,000 living annelid species. Most of an annelid's body consists of segments that are practically identical, having the same sets of internal organs and external chaetae. They make a significant contribution to soil fertility. Leeches have been long used in bloodletting practice, and some people regard ragworms as a delicacy. On the other hand, platyhelminths, or flatworms, are simple unsegmented, soft-bodied invertebrates. They lack specialized circulatory and respiratory organs. They are restricted to having flattened shapes that allow oxygen and nutrients to pass through their bodies by diffusion. The digestive cavity has only one opening for both ingestion, intake of nutrients, and egestion, removal of undigested wastes. As a result, the food cannot be processed continuously. Examples include turbellaria, which are mostly non-parasitic, or free-living carnivores, eating tiny aquatic invertebrates, and monogenia, which are parasites found on the skin, gills, or fins of fish. Trematodes, known as blood flukes, and cestodes, known as tapeworms. Cestodes, or tapeworms, are parasitic organisms. Humans can be infected by several species of tapeworms if they eat undercooked meat such as pork containing Taenia solium, beef containing Taenia saginata, or fish containing Diphyllobothrium. While their intermediate hosts include insects and crustaceans, Taenia saginata, the beef tapeworm, can grow up to 20 meters or 65 feet. Their bodies consist of many similar units known as proglottids, essentially packages of eggs, which are regularly shed into the environment to infect other organisms. This diagram illustrates the life cycle of the pork tapeworm, Taenia solium, and the disease it causes is called cysticercosis. Cysticercosis is an infection caused by the larva of the parasite Taenia solium. This infection occurs after a person swallows raw or undercooked meat from infected animals with tapeworm eggs. The larvae get into tissues such as heart muscle, brain, and eye, and form cysts called cysticerci. The beef tapeworm, Taenia saginata, is another common parasite. It is an intestinal parasite in humans, causing taniasis. Humans get infected as a result of eating raw or undercooked beef, which contains the infective larva. Cattle are the intermediate hosts, where larval development occurs, while humans are definitive hosts. These worms can get as tall as 22 meters, much taller than other human tapeworms. They causes taniasis in human intestine, but does not cause cysticercosis. Its infection is relatively harmless and clinically asymptomatic. Diphyllobothrium is a genus of tapeworms, which can cause diphyllobothriasis in humans through consumption of raw or undercooked fish. The principal species causing diphyllobothriasis is Diphyllobothrium latum, known as the broad or fish tapeworm, or broad fish tapeworm. Diphyllobothrium involves multiple hosts, including crustaceans, fish, and finally humans, and they can grow up to 12 meters long. In fish, Diphyllobothrium appears as plerocercoid larvae, often visible as small, white, elongated, spindle-shaped structures within the fish's muscles or other tissues. The third class of platyhelminths is trematodes, or flukes, including blood flukes. Blood flukes inhabit the blood in some stages of their life cycle. They cause swimmers' itch and schistosoma. The larval forms of trematodes penetrate the skin. Any contact with water containing these cercaria can potentially result in infection. Adult blood flukes can live for years in human, and some of them are carcinogenic parasites. Blood flukes, liver flukes, lung flukes, intestinal flukes, or schistosoma. They cause a disease called schistosomiasis. In Egypt, it is called snail fever, or bilharzia. In Asia, it is called Katayama fever. This disease is spread through contact with contaminated freshwater snails. They pass through an intermediate snail host before the next larval stage that infect a new mammalian host by directly penetrating the skin and parasitize the blood capillaries. Symptoms include abdominal pain, diarrhea, bloody stool or blood in the urine, liver damage, kidney failure, infertility, or bladder cancer. And in children, it causes poor growth and learning difficulty. This diagram illustrates the life cycle of schistosoma species. It shows the different stages of the worm's development, from eggs shed by an infected human to muricidia, penetrating freshwater snails as an intermediate host, to free-swimming cercaria that penetrate the human skin and reaches the systemic circulation reaching the human liver. The third major group of parasites is nematodes, or roundworms. Most species are free-living, feeding on microorganisms, but some are parasitic. The parasitic nematode are the cause of soil-transmitted helminthiasis. Unlike flatworms, nematodes have a tubular digestive system, with openings at both ends. Nematodes make up for many species. Nematodes that commonly parasitize humans include ascarids or Ascaris, filarias, hookworms, pinworms or Anterobius, and whipworms or Trichuris trichura, among others. Ascaris lumbricoides is a parasitic roundworm that causes ascariasis. It is the most common parasitic worm in humans. An estimated 807 million to 1.2 billion people are infected with Ascaris lumbricoides worldwide. People living in tropical and subtropical countries are at greater risk of infection. It is asymptomatic in 85% of the cases, especially if the number of worms is small. Symptoms increase with the number of worms present and may include shortness of breath and fever in the beginning of the disease. These may be followed by symptoms of abdominal swelling, abdominal pain, and diarrhea. Children are most commonly affected, and in this age group, the infection may also cause poor weight gain, malnutrition, and learning problems. If left untreated, these worms can grow to block the small intestine, which requires the surgical removal of these worms. Filarial worms, like Wuchereria bancrofti, are spread through mosquito bites. They damage the lymphatic system by nesting within the lymphatic vessels and disrupting the system's normal function. If left untreated, the infection can develop into lymphatic filariasis, causing leg elephantiasis. Treatment often involves albendazole and ivermectin. Onchocerca volvulus causes onchocerciasis, also known as river blindness. It's spread by black flies. Worms travel throughout the body using blood vessels in connective tissues and will settle behind the cornea, causing eye pain, redness, and eventually blindness. Treatment involves ivermectin and antibiotics like doxycycline. The guinea worm, or Dracunculus medinensis. It can grow up to 80 centimeters. Dracunculus medinensis is contracted through contaminated water. There is no medication to treat or prevent dracunculiasis, and the only treatment involves careful physical removal of the worm inch by inch for several weeks. Whipworm, or Trichuris trichura, infects the human large intestine. The female worms can lay up to 20,000 eggs per day. It can cause various symptoms, such as abdominal pain, fatigue, and diarrhea. It can be treated by a single dose of albendazole. Hookworms, like Ancylostoma duodenale and Necator americanus, are another common parasite. It lives in the small intestine of hosts such as humans, cats, and dogs. Females can lay 10,000 to 30,000 eggs per day. It causes abdominal pain, loss of appetite, protein deficiency, dry skin, edema, iron deficiency, anemia, mental dullness, heart failure, and infant mortality. It can be treated by albendazole and nabendazole. While Ancylostoma duodenale and Necator americanus are primarily known as intestinal parasites, there have been reports of hookworm larvae being found in the eyes and the subcutaneous layer, presented as worm-like tracts under the skin. Threadworm, or Strongyloides stercoralis. The life cycle of this parasite is more complex than that of most nematodes, with its alternation between free-living and parasitic cycles and its potential for autoinfection. It can parasitize humans. The adult parasitic stage lives in tunnels in the mucosa of the small intestine, causing the disease strongyloidiasis. It has also been reported in other mammals, including cats and dogs. Ivermectin is the drug of choice for treatment. Pinworms, or Enterobius vermicularis, are another common parasitic infection. They are transmitted by the ingestion of embryonated eggs by inadequate hand washing, nail biting, or inhalation, followed by swallowing of the airborne eggs. Female pinworms settle in the ileum, cecum, appendix, and ascending colon, where they attach themselves to the mucosa and ingest colonic contents. Female pinworms migrate through the colon towards the rectum. They emerge from the anus, moving on the skin near the anus to deposit the eggs cause itching in the anal area. It can be treated by albendazole. The fourth major group of parasites is Acanthocephala, or thorny-headed worms. They are characterized by the presence of an irreversible proboscis, armed with spines, which it uses to pierce and hold the gut wall of its host, and they measure from 10 to 65 centimeters. Acanthocephalans have a complex life cycle, involving at least two hosts, which may include invertebrates, fish, amphibians, birds, insects, and mammals. They can be transmitted to humans by ingesting infected animals or insects such as shrimps, rats, or cockroaches. Helminthiasis, or the parasitic worm infection in humans, can have adverse health consequences, depending on a number of factors, including the site of the infestation within the body, the type of worm involved, the number of worms, and their volume. Helminthiasis can trigger immunological responses, including fever, fatigue, dry cough, visual impairment, blood and feces, and increased susceptibility to other infections. Poor cognitive symptoms, including ataxia, growth retardation, and poor school or work performance, and malnutrition symptoms such as muscle aches, anemia, and malaise. Diagnosing parasitic infections involves various methods, such as the identification of eggs, worms, or segments in stools, and other tests such as serum antibody, endoscopy, and tissue biopsies. Transmission of parasitic infections occurs through cross-contamination. Eggs in human feces can contaminate vegetables, water, or soil, and the human host ingests these eggs by consuming poorly washed vegetables or drinking contaminated water. Note that no direct person-to-person transmission or infection from fresh feces can happen, because eggs passed in feces need about 3 weeks to mature in soil before they become infective. Prevention is key. It is important to raise awareness and health education. Avoid undercooked pork, meat, fish, or vegetables. Practice a high level of sanitation and hygiene. Clean and safe drinking water. Prevent fecal contamination of pig feeds. Stop open defecation. Prevent the use of human waste as a fertilizer. Regular deworming of pets, and periodic school-based deworming programs. Helminthic infections are prevalent in Malaysia, particularly among rural Aborigines and estate workers. Whipworm is the most common. Treatment of parasitic worm infections involves anthelmintic drugs. This diagram outlines the different classes of these drugs and their mechanisms of action. Benzimidazoles, like albendazole and albendazole, are broad-spectrum vermicides. They are effective against intestinal nematodes, roundworm, hookworms, tapeworm, and pinworm infections. They bind to tubulin to inhibit microtubule assembly, leading to impaired glucose uptake. They are pregnancy category C and teratogenic, and can cause abdominal pain, nausea, vomiting, and temporary hair loss. Macrocyclic lactones, like ivermectin, are effective against nematodes, such as river blindness, onchocerciasis, and lymphatic filariasis. They have strong affinity and binds to glutamate-gated chloride ion channels, resulting in increased influx of chloride ions, leading to hyperpolarization of the nerve and muscle cells, paralyzing and killing the worm. It's pregnancy category C, teratogenic drug. Praziquantel can be used to treat several types of parasitic worm infections, such as schistosomiasis, tapeworm infections, cysticercosis, taniasis, and most types of foodborne trematodiasis. However, it should not be used for eyeworm infections. Its mechanism of action involves increasing calcium ion permeability, leading to uncontrolled muscle contractions and paralysis. The WHO considers it safe during pregnancy. Piperazine and its derivative diethylcarbamazine are used to treat filariasis. They are selective GABA receptor agonist for helminths, causing hyperpolarization and worm paralysis. Common side effects include itching, facial swelling, headaches, and feeling tired. Diaminopyrimidines, DAP, include pyrimethamine, which is used for toxoplasmosis, and trimethoprim, which is used for pneumocystis pneumonia. Niclosamide is used for tapeworm infestations, including taniasis. However, it is not effective against other worms, such as flukes or roundworms. It works by inhibiting glucose uptake and oxidative phosphorylation by the worm. Pyrantel-pamoate is used for ascariasis, hookworms, and pinworms, and it can be used to treat worms in other animals. It's a depolarizing neuromuscular blocking agent, causing sudden contraction, followed by paralysis of the helminths, causing the worm to lose its grip on the intestinal wall and be passed out of the body. Levamisole is used for ascariasis and hookworm infections. It's a nicotinic acetylcholine receptor agonist, causing rapid muscle paralysis of the helminth due to ganglionic stimulation. Note that many insect ectoparasites, including bedbugs, batbugs, lice and fleas, have lost their ability to fly, relying instead on their hosts for transport. Pediculosis capitis, head lice, is a common condition caused by infestation of the hair and scalp by Pediculus humanus capitis. They are treated by 1% permethrin lotion applied to the scalp 10 minutes and wash off, in combination with oral ivermectin. Scabies is a contagious skin infestation by the tiny mite, Sarcoptes scabiei. They are treated with 5% permethrin cream, left on the skin for an approximate 14 hours before washing off, in combination with oral ivermectin. Thank you for your attention. I hope you found this presentation informative. Remember to stay safe, focused, revise effectively, and trust in your preparation. We're all rooting for you. Good luck with your exams.